Okay, it looks like we're going live here. I'm going to wait just a minute. Oh, we got a special guest. Everybody, this is Dr. Wagner. She's our attending physician here at Peachtree Pete's.
Who are you talking to?
Right now, I think we're talking to ourselves.
Okay.
I'm pretty sure. I don't think we have anybody yet. Maybe so. I don't know.
So you got a chart, and that's good.
Yeah.
Nice.
All right. I'm seeing.
I do in the nursery.
You have to?
I do.
All right.
I just thought, here, if you need props.
Dr. Wagner brought this in for Red Nose Day. We have one person.
We do. I don't know who it is. Oh, it's Stephanie Allen. Hey, girl. Hey. Hey, look who's here.
Hi, Steph.
Dr. Wagner's here. All right.
Okay, listen to him. He knows what he's talking about.
All right. So, what's going on, guys? Oh, nah. All right.
See you.
See ya. All right. So, what's up, y'all? Today we are gonna be talking about chronic cough. So, chronic cough is a big complaint. We get these a lot every single year. We get a ton of these complaints, and so I wanted to take a second today and to kind of. Oh, my wife is watching. Hey, wife. I hope the girls are watching. But anyway, take a second and talk about chronic cough. So. Again, super, super common. We get a ton of complaints about this. And so hopefully we'll get some value out of this and then go from there. So real quick, what is chronic cough and why is it important? So chronic cough, depending on the definition that you read, is a cough that lasts for 3 weeks or more. And we'll talk about reasons for that and that kind of thing. But I do have some really cool diagrams. It's probably backwards. Stephanie or wife, is this backwards to you? Does this look backwards? Am I missing my right eye or my left eye? Which eye am I missing? Oh, Kimmy, Marie, what's up? Anyway, so let's talk about this and let's talk about cough and why it's important. I'm going to move my phone. So as you can see here, You've got the nose. I'm going to put let's see here. So you've got nasal passages. Everybody's getting seasick. Here we go. It is backwards. That's okay. Oh, my Aunt Tracy's watching. Hey, Aunt Tracy. All right. So you got the nose. This is where pathogens will frequently come in, and they'll kind of set up shop up here. But then they will go down. This is down the back of the throat and then go down to the lungs. Now, you have two tubes that go to different places. One will go down to the lungs, and the other will go down to the stomach. Today's talk, we're going to talk specifically about the lungs, and I'll tell you why people get chronic cough. So that's just a little background into really just the upper respiratory system, kind of how it works. Down into the lungs, bronchioles, and that kind of thing. Some people call them bronicles, but you know. Hey, Samantha Bruce, what's going on? Chastity Marie, we got an audience here, folks. So, that's the background. Now, a few things about chronic cough, kind of the main reasons, okay? There's 3 things that we're going to talk about today, some of which you probably know about, some of which you may not, all right? So, when kids come in and the parents will say, I'll kind of do a few different examples. The first is when kids come in, they'll say things like, Chris, we've been noticing that little Jimmy has been coughing for 3 weeks, and he has this real nagging cough, and it's just it's real tight sounding, and it gets worse when he plays outside. He just starts coughing. And then, oh, Michael, what's up? Tubbers. Hey, my son, Tubbers. What's going on? I hope you got your hat on backwards today. So anyway, real tight cough, and gets worse when they play outside or when they get hot. That cough just doesn't go away. So the number one reason for that, and that backstory, it sounds a lot like this right here, asthma. So when you're talking about asthma is a oh, I forgot. Thanks, Stephanie. It's backwards. I'll have to figure out how to switch that. So with asthma, it's an inflammatory process in which the lungs will get really inflamed. And if you can imagine your lungs as tubes, so it'll look like this, but then when you have this asthmatic attack, your lungs will kind of start to get this inflammation and the tubes get smaller. And the result of that, your body tries to expel or to cough out that, and it just can't because, again, it's an inflammatory process, and they need help. All right, so I'm going to talk about a couple of different things that we have here in the office. These are called spacers. A lot of people have seen these, and I posted a picture of these. This is just a regular one. All right, medicine goes in there, goes in the mouth, ready to go. Okay, that's for a spacer for older kids. You have to be able to seal your mouth around this piece and then pull in the medicine and then go from there. All right, now I know what you're thinking. You're thinking to yourself, but Chris, my kid is little. They're not coordinated enough to do this. Fear not, my friend, fear not, because we've got one of these. Now, this is the same thing as this, but instead of having the mouthpiece, we've got like a little mask. So this will go right on the kid, all right, and they're not going to suffocate. This has got a valve in there, so they can breathe in all they want. They can breathe out. But when you do the medicine, it stays in this chamber, and then they'll breathe it in, and it goes into the lungs. And again, Gunnar and Barrett, what's up, boys? Good to hear from y'all. I hope y'all are okay. So the medicine will go in the lungs, and then again, the whole goal is to get rid of that inflammation. Now, why does that get started? It can be everything from a viral infection, it can be from a bacterial infection, it can be from allergies. And some people just have a really difficult time with their asthma, and even cold or extreme heat can kind of trigger an asthma attack. And then for the finale for the spacers is this tiny little guy right here. Look at that thing. It fits on a tiny little mouth. All right, goes on their face. You can see it doesn't even cover my eye. So this is a tiny one for the little babies, okay? So that's one thing that we can do. Now, so that's the first thing. When you're in the office, if your kid is having trouble, and when I say having trouble, what does that mean? You'll notice tracheal tugging. So you'll see that, like that kind of look. That means they're kind of getting into some trouble with their respiratory status, and they may need some help. So what do we do for that? We have these really cool things here, and I know a lot of y'all have these, but I'm just going to show you something that we have in the office. This is one example, but this is a nebulizer machine. All right, there's the on and off button. And what you do is it nebulizes medicine into the air, and then the kids will breathe it in. And when you nebulize medicine, I'll show you what it looks like. It's super, super, super small little particles. This is a little thing that we use. So kids, if you're watching this and you have to get a nebulizer treatment, it's not going to hurt you. But Mr. Chris broke it. Okay, so you can see the fine little mist coming out, and the whole goal is this mist will go deep into the lungs, and it helps again with asthma. So I have trouble with asthma sometimes. And so I have to do these. And so again, doesn't hurt, smells good. This actually isn't medicine, it's just a little saline. So again, it's not gonna hurt anything. But shoot! Hope you're still there. You fell down. Okay. So again, this is something else we can do. Now, if you have a kid that is let's just do this. If you have a kid that's having trouble and we feel like they need some help, what we'll do, hey Kayla and Dusty, what's going on? We'll actually give them one of these nebulizer machines to take home. So you can take this home yeah, you know, your kid will be there breathing easy. All right, so that's the first reason for a chronic cough. And I don't know if y'all can hear me with this machine on, give me a thumbs up. I don't know if you can or not, but anyway. So that's the first reason for a chronic cough. The next reason for a chronic cough is something that a lot of people don't think about. It's called GERD or reflux. And so when the kids get, especially when they're laying down, basically stomach acid will come up through their esophagus and it'll get into their lungs. Again, I'm going to show you kind of a little picture of what that looks like. So as you can tell with this picture, you've got the stomach down here. The acid will come all the way up and then get into the lungs. So the lungs will be up here. And if that happens long enough, the kids will have a chronic cough. And again, that's just something that I don't necessarily know if as a parent you would be able to tell. But, you know, if you want to bring your kid in, we're happy to look at them and see them and then be able to tease out little nuances on physical exam to tell if they have reflux or not. So that's the second thing. The last thing that is a consideration for a kid, again, and this kid, when they come into the office, the first one will typically be really any age, a little bit older, the asthma kid. A kid with reflux, normally they're a little bit younger kids, and the story will be, every time I lay my kid flat, they just get really, really, really fussy. And then throughout the day, they just have this cough, this real nagging cough. And so, that's the reflux kid. The last kid is a kid that their parents will say they had an upper respiratory infection 2 weeks ago, and after that they got a little bit better, but then they all of a sudden just started to get really, really bad. Their mucus is all kinds of different colors. They're having really bad headaches, like frontal headaches. And then they'll start to run a fever. Typically, these kids will wake up in the morning, blow a bunch of stuff out of their nose, and then they'll be, hey, Caitlin Turner, tell your husband I said hey. What was I saying? Shoot, what was I saying? Caitlin, you and your husband distracted me. They'll wake up in the morning, they'll blow their nose, lots of nasty stuff comes out, and then after that, they'll typically be okay for like the morning time, sort of. And then in the afternoons, they really start to get just super tired and cranky, and then their cough gets worse, especially when they're laying down. And so what that is it's actually a sinus infection. And so basically infection in the sinuses will be there, and it will continue to be there for a while. And so when kids will lay down, especially in the evenings, you'll get this drainage. They call it post-nasal drip. So post means after, nasal, the nose, drip means it's kind of coming down. And so when they do that, these kids will typically just start coughing and hacking, and this cough will not get better without antibiotics. So that's another reason to come in. So hey, Amy, what's going on? Hey, Donna, good to see y'all. So y'all, those are just a few reasons for chronic cough. Oftentimes we will also do, if a kid has a cough and they just look sick clinically, we can do some other testing. We can do a chest x-ray to make sure your kid didn't swallow anything, all right, like this. Hey, Megan Lowe, like if your kid has a little ring like this, they'll just be like, and swallow it, and then it'll be gone. And then you're like, oh, well, why is my kid coughing? Well, they swallowed a ring, right? That's a little magic trick I do for the kids. And so we can evaluate that with like a chest x-ray and find some other things that way. So that's really it, guys. Some of the common reasons for a chronic cough. Again, we have lots of cool toys in the office to get them fixed. And if need be, we can do medicines for that. And so, that's it. I hope that this was beneficial for you guys. If you like this and you want me to keep doing these, if you don't mind, just like the video and share it. And we'll do a live video every. You did tell me, Amy. You said you were going to watch this morning. Hey, Peanut. Oh, Samantha. Tell her I said hey. So anyway, if you guys like this video, please like it, please share it, and if we get enough good responses, I will do one of these every week, and just talk about some of the things that, hey Rowie, hey Gray, hey Reese, those are my girls, they're wonderful. No girls, I'm not on FaceTime. I can't hear what you're saying. Thanks so much guys for joining in, and share the video, like the page, and I hope you don't get sick. But if your kids do, I'm happy to see them. Thanks, guys.